Well, it's terrific to talk to you because this is a very special time in dentistry. Most of you know that our profession is changing rapidly. It's moving, unfortunately, to a much greater level of what I would call commodity-based care. And you'll see it on every advertisement. You'll see in the consolidation of dentists. And unfortunately, insurance is also playing an increasing role in our practices and more invading what is the doctor-patient relationship and telling us more or less how we should practice. And in most cases, practice less comprehensively and less thoroughly. And frankly, that doesn't fit my integrity, my honesty. I believe every patient deserves a comprehensive examination. There's a society. It is called the AES. I'm privileged to be president of that this next year. And that society is a society which is the leader in occlusion, TMD, and comprehensive oral care. And there's never been a greater need for us, because as our profession changes, you will be called upon, if you are one of those dentists who really want to be exceptional, who want to be unique in your community, to stand out, to serve people at a much higher level than many of your peers are serving them. And by going to and participating in an organization like AES, it will give you the opportunity to learn, to grow, to share. And so as president, my hope is that we can bring in many more people into the fold. It's an organization that's been here for over 63 years. And in that period of time, the giants of dentistry have all been here. Peter Dawson and Niles Gaucher and Bob Barkley and Frank Spear, John Coyce, Erwin Becker, you name those people, they've been here and they've been a key part of this. And those of us who've been privileged to come, as I have since 1975, a long time, cannot even measure the contribution this organization has made to us. But it's time for a new vision. And that new vision is that of physicians of the stomatognathic system, i.e. the mouth and the lower face. And that stomatognathic system, we will become, I think, the leading edge of medicine. Because right now our medical model is based on a remedial care model that people have to be ill before we treat them. That's going to bankrupt not only the health of our nations, it'll bankrupt each of our countries that try to support that. But we as dentists have always been preventive oriented, but we are now going to be challenged to be much more competent in our comprehensive examinations. And there is no organization that brings it all together in dentistry like AES. It truly is the leaders in occlusion, in TMD, and in comprehensive oral care. And I intend to do everything I can to get those of you that may be watching this who've never experienced AES to come and join us. You'll also find there a warmth of fellowship, of camaraderie, of sharing. You know, in this world, all of us belong to tribes. They're not like tribes of Native Americans, but in a way they are. They're tribes of people who have common values, like integrity and honesty and excellence and serving your patient at the level you would want to be served. And those are the values of AES.